Welcome to Webisode 20, where we will focus on the nursing scope of practice in an opioid treatment program setting. I am Joyce Winstead. I work as the practice director for the North Carolina Board of Nursing, and I have 40 years of nursing experience. The North Carolina Board of Nursing and the North Carolina State Opioid Treatment Authority, also known as SOTA, work together to clarify the relevant North Carolina laws and regulations which govern nursing scope of practice and the delivery of safe patient care in North Carolina licensed opioid treatment programs. The Board of Nursing and SOTA have a shared responsibility to assure that safe and professional opioid treatment program services are provided to patients and communities in North Carolina. The North Carolina Board of Nursing is empowered to administer the State of North Carolina Nursing Practice Act and its regulations, and the State Opioid Treatment Authority is designated with responsibilities for ensuring compliance with state authority regulations in 10A NCAC 27G. The SOTA has authority within the state for governing the treatment of addiction with an opioid drug, including program approval and for monitoring compliance with the regulations related to scope of practice, staff, and operations, and for monitoring compliance with the rules. Throughout the years, the North Carolina Board of Nursing and NC SOTA have received requests for consultation, education, and technical assistance activities related to nursing practice within opioid treatment programs. There is a concern that opioid treatment programs, including opioid treatment program sponsors, medical directors, program physicians, program directors, and nursing supervisors, may not fully understand the appropriate use of nurses within their legal scope of practice parameters in North Carolina. As a result, nurses have been asked to accept assignments that exceed their scope of practice beyond the scope of law and regulation in some opioid treatment programs. This can potentially contribute to serious medication errors, incidences, and other concerns with patient care. The practice of nursing in opioid treatment settings is a complex system of care which requires that all nurses, in fact, all staff in opioid treatment programs understand the parameters of the professional roles of nurses within the opioid treatment program setting. The North Carolina Nursing Practice Act and the North Carolina Administrative Code define RN and LPN scope of practice. This legally defined scope of practice cannot be expanded by an employer, a physician, or any other professional, and are consistently applicable across state settings. We developed this guidance to protect everyone who's impacted by nursing practices within opioid treatment programs. Both registered nurses and LPNs are responsible and accountable for practicing within their appropriate scope of practice. If they fail to do so, they may be in violation of the Nursing Practice Act and the North Carolina Administrative Code and may be subject to disciplinary action. All nurses are required to meet their professional responsibilities by complying with the reporting requirements mandated by the Nursing Practice Act if they have a reason to believe that the Nursing Practice Act has been violated. This information serves to protect the safety of patients by providing guidance for nurses and counseling staff. We will talk briefly about counsel scope of practice a bit later. Assuring compliance with North Carolina laws and rules protects the opioid treatment programs to ensure that programs are not placing nurses in a position outside of their scope of practice. Most importantly, strictly following North Carolina administrative codes regarding nursing scope of practice ensures the safe and professional opioid treatment program services are provided to the patients themselves and to the communities in which they live. The scope of practice of registered nurse practice is independent and comprehensive and does not require supervision by another licensed clinician. By comparison, LPN scope of practice is always dependent and directed. The LPN does not practice independently in any setting, including the opioid treatment programs. LPNs must have supervision by a registered nurse, a physician, nurse practitioner, or physician assistant continuously available for direction, guidance, and support. Registered nurses' duties include the assignment of nursing activities to other registered nurses, LPNs, and other assistive personnel. LPNs may assign nursing activities to other LPNs as determined by the registered nurse plan of care. LPNs should be mindful that they only accept those nursing tasks that fall within their scope of practice and which they can safely perform. Note that this applies to the assignment of specific nursing care activities for individual clients or populations. Non-nursing and non-clinical administrative functions, such as setting up schedules, are not considered clinical nursing practice and are permissible for the LPN to perform, provided the LPN is not placed in a position of assessing qualifications of personnel in relation to client care needs. The registered nurse, physician, nurse practitioner, or physician assistant assigning nursing care activities to the LPN is responsible for determining and providing the appropriate supervision. Administrative Rule 21 NCAC 36.0225 provides variables to include when determining the degree of supervision required for the performance of any assigned or delegated nursing activity by LPNs. It includes the educational preparation of the LPN. This refers to both the basic educational program that the LPN received and the knowledge and skills that have been acquired by the nurse through continuing education and practice. The stability of the client's condition, which involves both the predictability and the rate of change. For example, if a client's condition is one in which change is highly predictable and would be expected to occur over a period of days or weeks rather than minutes and hours, then the LPN may participate in the care with minimal supervision. However, if the client's condition is unpredictable or unstable, the LPN may only participate in the performance of the task under close supervision of the registered nurse or other person authorized by law to provide such supervision. The complexity of nursing task. This is determined by the depth of scientific body of knowledge upon which the action is based and by the task's potential threat to the client's well-being. Meanwhile, if a task is complex, the LPN may participate in the performance of the task under close supervision of a registered nurse, a physician, nurse practitioner, or PA. Other variables include the complexity and frequency of nursing care needed by the client population, the proximity of clients to personnel, the qualifications and number of personnel, the accessible resources, and then finally, the established policies, procedures, practices, and channels of communication that lend support to the different types of nursing services offered. Now we will talk about the roles of nurses in assessment, planning, and evaluation. It is important to remember that these variables, when making programmatic and personnel decisions within the opioid treatment program. Quite simply, registered nurses can independently engage in these functions. They can independently assess, plan, and implement nursing interventions and prescribe treatment for individuals, groups, or communities. And registered nurses can evaluate responses to nursing care and collaborate with others as needed. LPNs have a limited scope and may participate or assist with patient assessment, planning, and evaluation, but they can never fully independently perform these nursing activities. Registered nurses may develop and initiate plans of care by identifying client needs, prioritizing nursing diagnosis, and selecting or modifying nursing interventions. It is not within the LPN scope of practice to develop, modify, update, or initiate plans of care. Their role should be to implement nursing care as established in the healthcare plan and as assigned by the supervising registered nurse or medical provider. The management and administration of nursing services is the responsibility of the registered nurse and is outside of the scope of practice of LPNs. The LPN is permitted to serve in a lead nurse role in the opioid treatment program, provided the responsibilities are solely limited to administrative functions within the clinic, such as scheduling, time cards, payroll, and such. Whenever an LPN is providing services, even when they are serving in a lead nurse role in an opioid treatment program, the LPN must have registered nurse, physician, nurse practitioner, or PA supervision continuously available at all times. What does continuously available supervision mean? It means the supervising person can be a registered nurse, or it can be a physician, nurse practitioner, or a physician assistant. Of course, the supervising person can be available on site, or the supervising person may determine that supervision can be provided off-site. It may be acceptable to have an on-call registered nurse, physician, nurse practitioner, or PA. Regardless of the type of supervision, on-site or off-site, the supervising person is responsible for being continuously available to the LPN whenever the LPN is practicing nursing and or providing patient care. This can include availability by phone, video conferencing like Zoom or Teams, or availability by text or email. The supervising or on-call person must be able to physically arrive and be present on site in a timely manner as much as needed to address patient assessment and care needs. Of course, supervision includes oversight of clinical performance and responsibilities for periodic performance evaluation of LPN clinic practice and documentation of this, of course. LPNs participate in the collection of data and gathering information, including symptoms for the Clinical Opioid Withdrawal Scale, or COWS, and other data. However, it is not within the LPN scope of practice to make assessments, judgments, or decisions based on the COWS scale. Since assessment, decisions, and judgments fall solely within the scope of practice of registered nurses, when an LPN is the only nurse on duty, decisions about dosing would require either direct, in-person physician, nurse practitioner, physician assistant assessment and orders, or direct communication of patient signs and symptoms from a registered nurse or an LPN to a physician, nurse practitioner, or physician assistant to obtain specific verbal or electronic orders for induction, to withhold doses in the presence of impairment, and to direct next steps, or direct registered nurse assessment and professional judgment within the independent registered nurse scope of practice, and using appropriate physician, nurse practitioner, and physician assistant standing orders based on objective and subjective patient signs and symptoms. Some examples which exceed the LPN scope of practice in the opioid treatment programs include, but are not limited to, assessments and judgments in the initial induction phase of care, adjusting a patient's dose, determining patient impairment, and determining the need to withhold a medication dose. LPN consultation with a registered, certified, or licensed addictions professional is not an acceptable alternative to required consultation with a registered nurse, physician, nurse practitioner, or physician assistant to determine physiological impairment or withdrawal, or to recommend withholding of medication dosage or doses adjustments. It is outside of the scope of practice of a registered, certified, or licensed addictions professional in North Carolina to conduct medical or nursing assessments of patients or to direct decisions related to medication ordering, administration, or withholding. LPNs may implement clearly written physician, nurse practitioner, and physician assistant standing orders with no further medical judgments required. The North Carolina Board of Nursing position statement entitled Standing Orders provides additional information. A summary of the recommendations include: it is recommended that programs provide scope of practice education for all staff, including registered nurses, LPNs, physicians, nurse practitioners, physician assistants, registered, certified, and licensed addictions professionals, licensed behavioral health professionals, and qualified professionals. Doing so ensures that everyone understands the relative scope of practice of different levels of nursing licensure. It is recommended that programs develop and implement separate job descriptions for registered nurses and LPNs, appropriately delineating responsibilities consistent with North Carolina legal scope of practice. The separate job descriptions should specify overall registered nurse authority and responsibility for patient care, and should clearly delineate registered nurse supervisory authority and responsibility in relation to LPN practice, and should include differentiated core competencies. Supervising registered nurse at each opioid treatment program to supervise LPN practice and to perform all the assessments, planning, and evaluations requiring registered nurse level practice and judgment. This especially refers to decisions during induction and to withholding a dose of medication when a patient presents with impairment. Alternatively, when an LPN is serving in the absence of an employed registered nurse, opioid treatment program leadership must ensure consistent physician, nurse practitioner, or physician assistant presence on site to assume responsibility for patient assessment, planning, and evaluation, to provide continuous supervision of the LPN practice discussed previously. This plan should note who will assume responsibility for patient assessment, planning, and evaluation, and how continuous supervisory availability will be provided. Of course, we recommend that this plan be in writing and approved by the opioid treatment program's medical director. Dispensing of medications as defined in the North Carolina Pharmacy Practice Act and General Statute 90-85.3 is beyond the legal scope of practice for both registered nurses and LPNs. Such nurses are allowed to supply properly ordered methadone or other approved medications per the rules and regulations. It is jointly recommended that opioid treatment programs change the terminology from dispensing medication to supplying medication. We recommend that medical personnel write orders with attention to the composition of nursing staff employed within their organization and with attention to the scope of practice of LPNs and registered nurses. Program physicians may write things differently depending on whether the program employs exclusively registered nurses, some LPNs and some registered nurses, or majority LPNs. As always, both the North Carolina SOTA office and the North Carolina Board of Nursing are available for consultation. Please contact either organization if you have questions related to the scope of practice for nurses in an opioid treatment program setting.